So everyone, welcome back to my channel. So today we are going to look about ophthalmology therapeutics. First one is conjunctivitis. What all medicines can be given for conjunctivitis? First one is arsenicum album. It is indicated for burning watery eyes with a sensation of heat. Eyes may be red and swollen and they may be clear or acrid discharge. Symptoms are often worse during the night and may be accompanied by anxiety. So when you think about ourselves, you should remember about watery eyes, then burning. Ourselves will be indicated for burning with sensation of heat. So as it is burning, it will be red and swollen, and sometimes they will be clear or acrid discharge will be seen. Then what are the modalities? The symptoms will be worsened during the night and may be accompanied by anxiety. Second remedy is belladonna. It is indicated for sudden onset of intense redness, heat and swelling of the eyes. Eyes may feel dry, hot and sensitive to light. Pupils may be dilated and they might be throbbing pain. So when you think about the condition conjunctivitis, think about the symptoms of conjunctivitis, and when you write about homeopathic therapeutics, you can add those symptoms of conjunctivitis with respect to the symptoms of the medicine. So in belladonna we will say about the intense redness, heat and swelling of the eyes. Then the eyes may feel as dry, hot and sensitive to light, that is photophobia. And pupils, as belladonna, pupils will be dilated and they may be throbbing pain. Third one is sulfur. So when you think about sulfur, you should remember about burning and itching in the eyes. The discharge may be yellow or greenish. Symptoms may worsen with warm and improve with cool application. Next one is pulsatilla. It is indicated for mild, bland and thick yellow or green discharge from the eyes as the main symptom of the pulsatilla, that is thick yellow or green discharge. So eyes may be feel weepy and symptoms can change rapidly. Changeability and weepy tendency is seen here. Discomfort may be worse in the evening or in warm room. The next remedy is murk, which means merksol, indicated for profuse thick greenish yellowish discharge from the eyes. Eyes may be red, swollen and sensitive to light. Symptoms may be accompanied by a feeling of grittiness. So conjunctivitis is over. Next is ophthalmia of newborn. First remedy is aconite. It is indicated when symptoms come on suddenly after exposure to cold, dry winds. Eyes are red, congested and sensitive to light. They may be fear or restlessness associated with the onset of symptoms. Then is merksol, indicated for neonatal conjunctivitis with profuse thick yellow or greenish discharge from the eyes. Eyes may be red, swelling and sensitive to light. Symptoms may be accompanied by a fever and a general sense of weakness. Next is sulfur, which is indicated when there is burning and itching in the eyes. The discharge may be yellow greenish. The infant may be restless and may have a tendency to evolve. So in this picture you can see the ophthalmia of the newborns. That's it. Next is lycopodium, which is indicated when there is a swelling and redness of the eyes. Discharge may be acrid, causing irritation and redness. The infant may be irritable and have digestive issues. Next one is euphrasia, a great remedy for eyes. It is indicated for neonatal conjunctivitis with profuse acrid water discharge. Eyes may be red, swelling and sensitive to light. They may be decided to keep the eyes closed to elevate discomfort. So when you see about these things, the main things which you should keep in mind is when there is a problem with the eyes, it will be red, then sensitive to light, then burning sensation and maybe swelling. That's signs of inflammation will be seen. Next one is stye. So the remedy given is pulsatilla, which is indicated for styes that are typically on the upper eyelid. Remember, pulsatilla on the upper eyelid stye. The stye is often accompanied by tearing, itching and redness of the eyes. The discharge from the eye may be thick and yellowish green. Remember, pulsatilla. So it is thick and yellowish green. The symptoms are usually better with cold application, worse in the warm rooms. Next remedy is sepia, which is indicated for styes with a tendency to recur. So the styes may be accompanied by a feeling of heaviness in the eyes. The person may feel indifferent or irritable. Symptoms may worse in the evening. Next one is silicea. So pulsatilla, the chronic is silicea. So indicated for styes that are slow to heal and may separate. The stye may be hard and they can be sensitive to touch. Individuals needing silicea may be generally chilly and lack stamina. Cold air aggravates the symptoms. Next is Staphy's agria, which is indicated for the styes that occur after the plucking of the eyelashes. So if you guys are like a tendency to pluck your eyelash for when you get bored or anything, beware, because it can cause styes. So if you see such patients like that, or if you see such people, then remember to give them staph aureus. Or other injuries can also be given. The stye may be painful and may be associated with the feeling of being offended or suppressed. Warm compresses may provide relief. So main mind symptom is offended or feeling suppressed. That feeling will be there for staph aureus. Next is thuja, which is indicated for styes that are recurrent or appear after vaccination. So a remedy that is given for bad effects of vaccination is thuja. So that can be given if the stye is coming after the bad effects of vaccination. The stye may be painless or mildly painful. They might be a general sense of sensitivity and a feeling of being chilly. Next is cataract, which is mainly seen on old age people. The remedy given is sulfur, indicated for cataracts with burning sensation in the eyes. Individuals may experience a sensation of heat and dryness. Symptoms may be worsened from the warmth and especially in bed. So in this picture you can see the cataract. The calcarea curve indicated for cataracts in individuals with a tendency toward obesity or those who are fair-skinned. There may be a feeling of coldness and dampness. Vision might be impaired and they could be associated headaches. The next is lycopodium, which is indicated for cataracts with symptoms such as blurred vision, especially on the right side. Individuals may experience digestive issues like bloating and gas. Symptoms may worsen in the late afternoon and evening. Next is cylesia, which is given for indicated for cataracts with a tendency toward delayed healing. There may be a sensation of redness in the eyes. Symptoms may be worse from cold and improved by warmth. Next is phosphorus, indicated for cataracts with a sensitivity to light. It's photophobia. Individuals may experience halo-like effects around eyes. There may be a tendency to bleed easily, and vision problems can be accompanied by anxiety. So next one is glaucoma. So in this picture you can see the difference between cataract and glaucoma. Cataract means opacity of the lens and glaucoma means due to pressure difference in the eyes. Okay, so the remedy set is given as phosphorus. Phosphorus indicated when there are visual disturbance like halos around eyes. Individuals may experience pressure and heat in the eyes. There may be tendency toward bleeding tendency and preference for cold drinks. Obviously that's the symptoms of phosphorus. Then it is gelsemia, that is indicated when there is a heavy drooping sensation in the eyelids. Vision may be blurred and there may be pain in and around the eyes. Individuals may feel weak and lethargic. Next one is chlorosynthesis, which is indicated when there is a severe pain in and around the eyes, often described as a cutting or stabbing pain. Pain may be relieved by applying firm pressure to the eye. Symptoms may associate with digestive issues. So next one is neonatorum muriaticum, which is indicated for glaucoma with a sensation of pressure and pulsation in the eyes. Individuals may have craving for salty foods. Emotional factors, especially grief, may be associated with the symptoms. The next one is epilepsy mellifica, which is indicated when there is stinging or burning pain in the eyes. The eyes may be red and swollen and they may be sensitive to light. Symptoms may be relieved by applying cold. Next one is myopia. So the remedy is physostigma, indicated for myopia with peak ciliary muscles. Individuals may experience difficulty in focusing on distant objects. Eye strain and headaches may be present. Next one is rotagravelans, indicated for myopia with eye strain and fatigue. Individuals may experience pain and stiffness in the eye muscles, often considered for eye condition related to overuse like excessive reading or coursework. You have also, you can see in Alan's keynote that about small work like eye straining using sewing, needle, putting thread and needle. So those things will, those people for tailors and all, we can give for rotagravelans, we can give it for them. Calcarea fluorica is the next remedy, which is indicated for myopia with a tendency for hardening or calcification of the eyeball. Individuals may experience a sensation of tightness or pressure around the eyes. Consider for conditions related to tissue elasticity. Next is neonatorum muriatica. Tell me, what are the symptoms? History of grief, emotional stress, craves, salty foods, emotional factors. That's all. Then Cinerea maritima eye drops. These are recommended for various eye conditions like myopia, for eye fatigue, blurred vision and other guidance symptoms of healthcare. The use of these eye drops should be under the guidance of healthcare professionals. Then next one is hypermetropia. Cornea maculatum is a remedy indicated with the feeling of weakness or stiffness in the eyes. Individuals may experience blurred vision, especially after reading or coursework, often considered for eye conditions related to overuse. Next is rotagravelans, which is given for eye strain and fatigue with a sensation of pressure and bruising in the eyes. Then excessive use of close work will be, as I told before. Next is epismerifica, where the sensation of stinging or burning pain, eyes may be red and swelling, they may be sensitive to the light, often considered conditions involving inflammation. Next is neonatorum. Tell me, what is it? History of grief or emotional stress, salty food. So when you go through these, you can understand that for some eye symptoms, there will be similarity of the symptoms which is given for the particular medicine. So you could learn like that and memorize it. So even though I am repeating the same kind of, it will help you to memorize it. So when you think about ophthalmology therapeutics, you should think about some remedies in your mind and some similar highlighting points. So you can write it on each and every point for that all medicines. So it will be easy for you guys. Next is cuprum metallicum, which is given with a tendency towards spasms or twitching of the eye muscles, given for the individuals who experience sensation of tiredness or constriction around the eyes. Muscular issues is the main remedy. Next is photophobia. Belladonna is an indicated remedy which is having intense sensitivity to light. Eyes may be red and inflamed. There may be throbbing pain. Individuals may also experience fever and restlessness. Euphrasia is indicated for photophobia with a copious, acrid and watery discharge from the eyes. Eyes may be red or irritated and feel as if a foreign body present. Symptoms may worsen in open air and improve with cold compressions. So next is photophobia. Photophobia is given for patients. The remedies given is belladonna, which is indicated for sudden onset or intense sensitivity to light. Eyes may be red and inflamed and there may be throbbing pain. Individuals may also experience a fever and restlessness. Next one is euphrasia, which is indicated for photophobia with a copious, acrid and watery discharge from the eyes. Eyes may be red and irritated and feel as there is a foreign body present. Symptoms may worsen in open air and improve with cold compressions. Next is chalcemia, indicated for photophobia with a feeling of heaviness and drooping of the eyelids. Individuals may experience dizziness and general weakness. Symptoms may worsen with anticipation or excitement. Next is neonatorum muriaticum. Neonatorum muriaticum, as I told before. So when you think about neonatorum muriaticum, another symptom that should come to your mind is headache with sunlight exposure. You can add that also. And spigelia, which is indicated for sharp stabbing pain in the eyes aggravated by the light, and they may be sensitive as if the eyes are being pulled backward. Symptoms may be worse with the moment at night. So that's all about this topic. Thank you for listening. Hope you guys